Good morning and welcome to COVID-19 Talk with local health authorities. Joining me from Harris County is Dr. Erica Brown from the City of Houston, Dr. David Pearce. Special thanks to past President, Rotary Club of Houston, Kathy Feniger, and our producer, uh, David Castillo. I'm Stephen Williams, Director of the Houston Health Department. Well, as health authorities, y'all have been pretty busy over the last couple of weeks, not only with COVID, but also with monkeypox. And so let's get started. There's still a number of COVID questions. With the new guidelines, COVID seemed to be treated like any other virus. Would you simplify by saying symptomatic, stay home? What about asymptomatic without a household member positive?
So, David, you're going to jump in? Oh, I'll take that. If I understand the question, we're asking about asymptomatic positive family members and what should the family members do? So that's the question I'm going to answer.
Okay.
Family members are asked to monitor themselves for symptoms. They're not required to, or asked to quarantine any longer unless they become symptomatic. Then they should go to the testing route. What they are asked to do, as we all should be doing still, is wear a mask. Anytime they're in public or going out for any reason, they should wear a mask for certainly the time that the positive person is experiencing symptoms and 10 days after that time. But I know it's confusing. So ultimately, to make it real simple, wear a mask. If you become symptomatic, go get tested.
FDA said asymptomatic people should take 3 tests 48 hours apart to reduce false negatives, and those with symptoms taking 2 tests 48 hours apart. Please elaborate.
Yeah, so this goes to the realization that the at-home rapid tests are, there's some degree of false negative. It's depending on where you read, it's anywhere between perhaps 20%, some places as high as 40%. But what it has to do with is that in order for the test to turn positive, you have to have enough virus and enough immune response for it to show up on the test. So early infections where people have been infected, they're starting to have a response. It may just not be enough to turn the test positive. So what they're saying is if you think you've been exposed. So I had dinner with a bunch of friends last night, and I got a call this morning, and one of them tested positive. He felt crummy last night at dinner, didn't do anything, but today he decided to test. Oh my gosh, it's positive, and we were at dinner together last night. It does me little good to test right now, because if I was infected last night, I'm not going to test positive today. It's just way too early. So what I'm advising people to do is remember the incubation period is generally up to 5 days, is to wear a mask for the 5 days and try to isolate yourself as best you can. And then beginning on the 4th or 5th day, take a test. If it's negative, continue to isolate and protect yourself or protect your family members in particular for 48 hours, take another test. So what the FDA is saying, if you're asymptomatic, you should do that up to 3 tests. If you develop symptoms, there's a chance you're infected with something else. But if you have symptoms and you wind up having 2 negative tests 48 hours apart, you're probably infected with something else. Because if you're having symptoms after your second test, if you had COVID, you should have tested positive by then.
A little bit different spin, but related. If exposed to COVID, you wear a mask for 10 days. Is it correct that the vaccine status doesn't matter? Vaccination status doesn't matter.
It is correct because as we know, with the variants, some of the vaccines that are currently available may not be as efficacious against the newer strains. So yes, it doesn't matter if you're vaccinated or not, you should wear a mask.
Dr. Pearce, you recently said we have reached herd immunity. Has BA5 had its worst impact now? Take out that crystal ball.
So interesting, Dr. Brown and I were on a talk this morning, and the estimates are now that in the high 90% of people in Houston, Harris County have antibodies, whether that's from a previous infection or it's from vaccination. So when we talk about herd immunity, that's where I'm getting that from, is that we've got a high degree of immunity. Now, that having been said, that doesn't mean that people aren't going to get infected again, even if you've got antibodies, because there's been a bunch of variants and your immunity is going to wane over time that we've seen. So this last wave of BA5 spread, the thing about BA5 is it spread so easily and so rapidly. So we saw a lot of folks, we saw wastewater shoot up very high. We saw positivity up to 30%. Hospitalizations, not so much, and now things are trending down. So I think that BA5 spread throughout the community pretty effectively. We didn't take a big hit in terms of people getting hospitalized or dying. People did die, but not to the rate and the numbers we saw before. My prediction is we will see more waves because as some people's immunity wanes a little bit, we'll get some more, but they just won't be anywhere near what we've seen in the past, assuming we get no new variants.
Wastewater, COVID, monkeypox, polio, anything else sneaking in?
So that's a wastewater one. Well, I'll take that. So we're about to pretty soon here, the next week or two, we hope we'll be reporting monkeypox and perhaps polio in the wastewater as well. At this point, you know, we're keeping an eye on a couple of things. There's the BA 2.75 that really doesn't seem to be spreading too much, so we may not need to worry about that. And then there's a another illness which there's a handful of cases in China. Forgetting the name that they gave it, but that doesn't seem to be spreading in. So right now, COVID, monkeypox, and polio, I think that's enough.
For those having loss of taste and smell, are women more likely to have permanent impact? And are people more likely to recover smell before taste?
So this is pretty interesting. The limited data that we have does indicate that women are more likely to lose taste and smell, specifically smell. Again, I am cautious about the data because we're still analyzing, and so and the set that was looked at, the set of people that was looked at is extremely small. But of that, it does appear that women are more affected. The good news, though, is that by 6 months, it seems that almost everybody recovers their taste and or smell if they lose it.
How likely is it that I never had COVID? I've started hearing people who thought they were immune turning up with light cases.
Yeah, so that's a good question. So I, for one, I don't think I've been infected. I mean, let me put it this way. I've never become symptomatic. So now I've been up to date on my vaccines all along, and I've been wearing masks and I've been protecting myself. But if I were to get a test and it came back and showed that I had in fact been infected, I wouldn't be terribly surprised because remember, about 40% of people who are infected have no symptoms at all. So I think the chance of somebody who to actually have never been infected is really small. And like I said earlier, we know that from the tests that University of Texas is telling us that it's like 98% of the people have got antibodies. So I'm thinking your chance of having never been infected is less than 2%.
When my kids were young, the desire for the perfect attendance award ended up spreading all types of illnesses. Now, some Houston employers are eliminating COVID paid sick leave. Your thoughts?
So David, do you want to take it as they're asking about Houston?
It doesn't matter.
Okay. So, I think as we continue to move through the pandemic, hopefully moving to an endemic state, but not there yet. I think we do need to consider how do we as a society treat this in our regular daily lives, like other regular illnesses that we would see. While perfect attendance is absolutely something to strive for, in school, it's a badge of honor. Sometimes, frankly, though, I think it is to a fault of the safety and health of the child and the well-being of all of those, including the teachers and all of those who assist in the school. So, if a child is sick, if a teacher is sick, that we are encouraging that you stay home and take care of yourself, because as Dr. Peirce has often said, even if you don't have COVID, you got something. So we encourage you actually to stay home.
One recent study reported in the Atlantic noted that overall, household secondary attack rate was 42.7% for early Omicron. What are you seeing? Does it depend on how careful everyone is?
So that 42.7%, that comes from an article, a pretty well done study in the Journal of the American Medical Association. And what they did was they looked at the secondary attack rate within households between different variants, and Omicron had the highest at 42.7. And if you think about it for a moment, that's a pretty high secondary attack rate within households. I don't have a specific number for us, but we've been seeing the same thing. We've been seeing a lot of intra-household spread of the virus. And this just really goes to the fact that Omicron spread so much more easily than its previous variants. And that, in fact, is why it became the predominant variant that we had to deal with, because it spread more easily. So, yeah, it's consistent with what we've seen and really not a huge surprise.
After recently recovering from COVID, I'm being more careful about masking in a crowd, but feel a little bit bulletproof. How long can I reasonably expect to retain high immunity?
So that's a loaded question. Oftentimes at this point, when you are recovering or have had recent COVID infection, we're not clear on which strain you've had. We do know that you can have reinfection in a fairly close proximity to recent infection. So I think it's a misnomer that you're bulletproof. It does afford you some immunity, but because of the different strains that are out, you may and can be reinfected. So still encourage you to go ahead and wear the mask. I think that's the right thing to do.
Moderna's CEO likened COVID vaccines to an iPhone where you get a new one every year. Is it true?
Well, I don't know who wrote this question, or I don't know the Moderna CEO, but I don't get a new iPhone every year. So let me start off with that. Secondarily, the idea of getting vaccinated for COVID every year, there's a couple of things that we need to find out. Right now, we know that the antibodies that you initially produce begin to wane 4 to 6 months, but they don't completely go away. The other part of the equation is the cellular immunity, the T cell immunity. That's the long-term immunity. We have a great feel right now as to how effective that will be. So I think there's a little bit of homework that we still need to do to find out. And of course, then again, do we have yet another new variant? So Moderna and Pfizer are both about to come out pretty soon here with the bivalent vaccine, which will cover the wild type, the original, plus BA.5. And so it's possible. It wouldn't surprise me, but I think we've still got a lot of work to do before we can make that determination of whether or not it'd be an annual thing. But I would like, on the annual, I would like to remind people, we've not had a lot of flu in our community for the last couple of years, which means our herd immunity for flu is pretty low right now. So we're kind of a setup for a really bad flu year. So as soon as flu vaccine becomes available, I'm getting mine, and I would encourage you to get yours too.
What about one mRNA vaccine to cover everything, including flu?
So that was a great segue. So there's two things occurring right now in the scientific community. One is continuing to research to produce a bivalent vaccine, which we know should be coming out hopefully sometime in the fall. The second thing that's occurring is a COVID flu vaccine, but that's a little further away than the bivalent vaccine. And it looks like, unless David, you have any other information, it looks like that may be available to us sometime for next year's flu/COVID season.
I have a pharmacist family member and have been worried for the entire pandemic. Why? People take off their masks to cough, have gaps on sides of masks so large you can insert an apple, walk into a pharmacy with no mask while coughing to ask for a rapid antigen test. Can you ask viewers to be considerate of everyone, especially those who still work in high-risk jobs? I think that person just did.
Yeah, I think so. And I think this is an opportunity really, though, to recognize all of those who have been in the healthcare field, who have participated in the logistics of assisting those in the healthcare field and operations throughout this entire pandemic, and really give a big thank you to them, and to be mindful that these people have been working a very long time in a very stressful situation to make sure that our communities have what they need to recover from this pandemic. And so the best we can do to be mindful of those who are on the front lines, I personally think we should do it and would encourage everybody else to do so as well.
Please comment on at least 8 cases of monkeypox in kids.
I know it's my turn, but I'm going to defer that to Dr. Brown, as Harris County has a possible pediatric case.
Sure. So obviously we cannot get into a lot of detail about the case. Of the 8 cases that we know of across the country, 7 of them have been through direct contact of an age group where direct contact is certainly not necessarily something we want to see, but in terms of just the age group, but it's certainly possible. We do have a case in a younger child that we're currently investigating, and we'll follow up as soon as we have additional information on that one.
Okay. Several articles said rebounds are surprisingly common even without taking Paxlovid. Any idea what the difference is in percentage with those rebounding after no medication?
Yeah, so my understanding is, so first of all, you can get rebound with people who didn't take Paxlovid. So that was one of the things that a little bit frustrated me when the media was jumping all over Paxlovid for the rebound cases, because it happens even if you don't get Paxlovid. And so the difference between the two is really small. I want to say, I'd have to look it up, but I want to say it's only about a 2% difference. It's not greatly different. And certainly no reason to not take Paxlovid. It doesn't cause rebounds. It can happen anyways.
Is the rebound usually worse after taking Paxlovid?
So rebound varies from person to person. And we're really not sure. Again, studies are still ongoing for that, but it seems to vary person to person. And to echo David's point about that, can happen in people who weren't treated with Paxlovid as well.
Have there been cases of more than one rebound close together?
So a bit of a difficult question to answer because close is a relative term, because we have had cases of people who have been ill, had symptoms, recovered, and then within a few weeks developed symptoms again. And so, the question is that a rebound or is that another infection? And so it has to do with what is the gap? And so we've clearly seen people who have developed symptoms again, probably because they got infected with another variant, which goes to the fact that if you were infected with Alpha and then you got exposed to Delta, you can certainly get sick again. There's a sufficient difference between the viruses that, yes, sometimes your immunity to one is not going to provide you great immunity to the second one. Now, you're probably not going to get terribly sick the second time around. You're going to get some benefit, but sure, could you become symptomatic again? Absolutely.
Does Paxlovid offer ongoing resistance to COVID? If so, for how long?
Yes, so to clarify, Paxlovid is not meant to offer ongoing immunity to COVID. What it is meant to do is to lessen severe symptoms of those who have been diagnosed with COVID. So the best way to prevent against ongoing or to provide ongoing resistance is vaccination.
A lot of rebound questions. How long after an infection could you experience a rebound? I'm still waiting, and anticipation is more stressful than getting it the first time.
Yeah, so this kind of goes back to what I was talking about earlier, and I'm not remembering, and Dr. Brown, if you remember, there is a definition. If you develop symptoms again within a certain time frame, it's considered a rebound. If it's beyond that, it's considered a probable new infection. I want to say 6 weeks. Is that?
So the CDC is defining rebound as 2 to 8 days after initial recovery.
Oh, okay.
Okay.
What medication is recommended for young children with COVID?
So treatment recommendations do vary by age. Some medications include Paxlovid. I'm going to mess this up. Betablimab, and remdesivir for young children. The remdesivir has been approved for children 28 days up to 3 kilograms, which is 7 pounds. And then the others, Paxlovid and betablimab, are for children who are a little bit older, I think over the age of 12.
Okay. Does there seem to be a rise in neurologic complications in hospitalized children with COVID?
So for anyone who's hospitalized with COVID, your chances of a complication are definitely higher, as is your chances for experiencing long COVID. So the answer to the question is yes. Now, the flip side, though, is that fortunately, kids tend to have fewer complications than adults. So that's the good news.
Many children in underserved communities have not been vaccinated. What is being done to assist?
Yeah, so this is really a great public health question, and it speaks to equity. Unfortunately, there's been a longstanding culture for various reasons, right, in the underserved communities, and healthcare in general, including public health, has not always done a great job at providing a grassroots campaign to get out into those underserved communities and answer questions and quell any fears that they may have and provide education. So to that end, COVID really highlighted a lot of those gaps. And so we have been, and Houston has been working together to really get into those communities and provide grassroots education and take the vaccine education and outreach to the community as opposed to asking the community to come to us.
Centauris BA 2.575 subvariant of Omicron under monitoring. What does that mean?
So this is the most recent new variant that sort of hit the radar, and that's because it started spreading in a couple places around the world, and most interestingly in India. It started growing, and so the question was it going to become the next variant that was going to have an impact worldwide? And when they looked at it very closely, they found that it was spreading in an area in India where BA2 had been the predominant variant, and it took over, if you will. It's a subvariant of BA2, hence BA 2.75. In other parts of India where BA5 had been predominant, it never really took off. So it was not able to outcompete BA5. And so they're still watching it, but it doesn't seem to be able to, basically, it doesn't seem to be able to outcompete BA5, which is the one that is impacting most of the world. So still keeping an eye on it, but at this point, keeping our fingers crossed it's not going to become the next variant that we have to worry about.
The stress hormone cortisol predicts who develop long COVID and the severity of the virus. True or false?
So we don't know. There is some recent data that shows that potentially low levels of cortisol go along with long COVID symptoms. Cortisol is a stress hormone, and so high levels, it appears, may ward off long COVID, but there's still studies going on.
The UK has already approved a spike vaccine, bivalent or original Omicron, which appears to be for the original and BA1. An announcement this week predicted availability in the US in the fall. Where are we now? What variants will this target?
Yeah, so here in the United States, both Moderna and Pfizer approached the FDA with a bivalent vaccine recipe, I'll say, for BA1, BA2, and wild type. And the results are encouraging. The FDA, and they said at that point that they felt they'd be able to have manufacturing and product to the community by September. But at that point, the FDA realized that, BA1, BA2 were no longer the issue in the United States. It was BA5. And so they sort of sent them back to the drawing board and said, come back with a bivalent that will protect against BA5. The initial prediction was that would push back production to November. But they have now recently come back and said that no, they're still thinking maybe late September, October. So where we stand today is it looks like Moderna and Pfizer are working towards a wild type / BA5 vaccine, and it hopefully will be here early in the school year, late September, maybe early October. So that's great news.
BCG, a TB vaccine used to protect people with type 1 from COVID. Projection for expanded use?
Yeah, so this is pretty interesting. Researchers at Massachusetts General published a new study demonstrating that 3 doses of BCG vaccine protected patients who were type 1 diabetic. So I want to be clear that this was a very small group of people, very specific group of people, but they did show an overall vaccine effectiveness of 92%. So we're hoping that larger studies will be done, as obviously in order to say that this would be efficacious for the community, we would need to engage a lot of different groups, not just the type 1 diabetics.
Okay, retrospective. What have we done right or wrong and should consider now?
Then we just talked about this.
Yeah, that's also a loaded question. And we could spend a lot of time talking about it. So first of all, I want to point out, we've done a lot of things right, okay? That doesn't get the attention. What gets the attention is the things that were done wrong. And right now, based on the announcement coming out of the CDC yesterday, where Director Walensky wants to take a look at the structure and operation of the CDC, this is the question sort of coming up. I think that we need to learn that one of the things we could have done better is at a national level our public messaging. I also want to point out that we didn't get a lot of help from some of our politicians who quickly politicized this and filled the conversation with a lot of misinformation, and then directed folks emotionally, I think, in a not helpful way. Nevertheless, we could have done better with the messaging. Part of it is we need to keep it clear and straightforward, less complicated, and hopefully, we've learned from that. And now we're going to be dealing with monkeypox, and hopefully, we will have more straightforward communication or messaging with monkeypox. That's my 2 cents. I don't know, Dr. Brown, you want to add something?
Sure. So I absolutely would agree. I think there were a lot of things done right, given the fact that this is something that we have not seen in most of our lifetimes. I do think that it highlighted some gaps that we need to address. And I think part of what we have done and are doing right is really taking a deep dive, stepping back and taking a deep dive at those gaps to make sure that we're prepared for the next time. Unfortunately, there was an unprecedented amount of illness and death with this pandemic. And so clearly there's a lot for us to work on, but I think the pieces that those who've been involved in really trying to mitigate a lot of that, I don't think they could have done a better job. I mean, there were so many who stepped up to want to help, to try to help. And I think that should not be lost among something that we've never seen before. There's always hindsight, but I do think that we need to make sure that we are acknowledging those who really have done a phenomenal job on the front lines.
And it's not over.
It's not over.
Actually, it's chapter 2. I want to thank you for joining us for COVID-19 Talk with Local Health Authorities. Representing the county, Dr. Erica Brown, the city, Dr. David Purse. Special thanks to past President Kathy Finninger, Rotary Club of Houston, who actually collects these questions for us, and our producer, David Castillo. I'm Stephen Williams, Director, Houston Health Department.